Sponsored by RxCardClub.com. Get a free prescription drug card and save up to 85% on prescription drugs. RxCardClub.com. What happens when you stop taking Zepbound? If you stop using Zepbound, you will most likely regain much of the weight you have lost. In 88 month-long studies, people who stopped treatment after 36 months regained 14% of their body weight, compared to a 25% weight loss in those who stayed on the medicine. Speak with your doctor before you stop using Zepbound. Obesity or being overweight are chronic, long-term, health conditions that often require long-term medical treatment. Your healthcare provider may suggest that you switch to another medicine, adjust your dose, or add changes to your exercise and diet routine to help control weight gain. If you are having trouble getting Zepbound, Tirzepatide, at the pharmacy due to a drug shortage or cost issues, your healthcare provider may be able to recommend other treatments or money-saving options. Eli Lilly, the manufacturer, may be able to offer copay assistance or patient financial assistance, if you qualify. Will I regain the weight I lost if I stop Zepbound? Studies have shown that weight regain is common when weight loss treatments like Zepbound are discontinued. Most patients will need to remain on treatment to improve or maintain their current level of weight loss. The Phase SURMONT 4 study evaluated 783 people with obesity or overweight but without type 2 diabetes. Mean body weight for patients at the start of the study was 107.3 kilograms, 236 pounds. The objective was to look at the effect of Tirzepatide on maintaining weight loss over time, when used alongside diet and exercise. The researchers sought to determine what the average % change in weight over the year. They also looked at the number of people at the end of the year who kept off at least 80% of their weight loss. All of the patients received Zepbound given subcutaneously once a week for 36 weeks, 9 months, along with diet and exercise. Doses were increased slowly up to a maximum of a 10 mg or 15 mg dose. After 36 weeks, 335 patients continued treatment with Zepbound injections for an additional year, 52 weeks, and 335 patients took a placebo, inactive, shot during this time. Results. In the first 36 weeks, people using Zepbound lost an average of about 21% of their weight. Over the next year, people who continued on Zepbound had an additional weight loss of 5.5%, on average, while those taking the placebo shot had a weight regain of 14%, a statistically significant difference, p less than 0.01, which means the results did not happen just by chance. On average, over the 1 year and 9 month period, 88 weeks, people taking Zepbound had a 25.3% weight loss and those using the placebo shot had a regain of 9.9% of their weight. In addition, close to 90% of those receiving Zepbound at week 88 had kept off at least 80% of the weight they lost in the first 36 weeks, compared to about 17% of the placebo group, also a significant difference. Common side effects. The most common side effects were stomach-related and occurred more frequently with Zepbound than placebo. During the first 36 weeks these included nausea, 36%, diarrhea, 21%, constipation, 21%, and vomiting, 16%. Most stomach-related side effects were reported as mild to moderate and decreased and leveled off over the 88-week treatment period. In the first 36 weeks, 7% of patients dropped out of the study due to stomach-related side effects. Related questions: how do Ozempic, Mounjaro, Wegovy, Zepbound compare for weight loss? Tirzepatide versus semaglutide, how do they compare? Can you get Tirzepatide from a compounding pharmacy? How long has Zepbound been on the market? In November 2023, the U.S. Food and Drug Administration, FDA, approved Eli Lilly's Zepbound, Tirzepatide, a glucose-dependent insulinotropic polypeptide, GIP, and glucagon-like peptide 1, GLP-1, receptor agonist. But Lillys Mounjaro, which also contains Tirzepatide, was first approved for blood sugar control in adults with type 2 diabetes in May 2022. Zepbound is indicated for weight loss in adults with obesity, BMI 30 kg/m2, or who are overweight, BMI 27 kg/m2, and have weight-related medical conditions like high blood pressure, type 2 diabetes, heart disease or high lipid levels. How does Zepbound cause weight loss? Zepbound works by activating the receptors for the incretin hormones GIP and GLP-1 to slow down the movement of food through your digestive tract. This action decreases your appetite and lengthens the amount of time you feel full after eating. Zepbound is given as a subcutaneous, under the skin, injection once a week into the stomach area, thigh, or upper arm using a pre-filled pen. Zepbound is available in 6 strengths, 2.5 mg, 5 mg, 7.5 mg, 10 mg, 12.5 mg, and 15 mg, and comes with 4 single-dose pens per carton. Approval studies for Zepbound. FDA approval for Zepbound was based on results from the 72-week, Phase SURMOUNT studies. In SURMOUNT 1, people without type 2 diabetes taking Zepbound 15 mg lost an average of 48 pounds, and those taking 5 mg lost an average 34 pounds, compared to 7 pounds on placebo, an inactive treatment. In SURMOUNT 2, people with type 2 diabetes taking Zepbound 15 mg lost an average of 34 pounds and those on the 10 mg dose lost an average of 30 pounds compared to 7 pounds on placebo. In these studies, the most common side effects were nausea, diarrhea, vomiting, constipation, stomach area pain, heartburn, injection site reactions, tiredness, allergic reactions, belching, burping, and hair loss. Zepbound also carries a boxed warning for the risk of thyroid C-cell tumors, as with other incretin mimetics. What about Ozempic? Will I regain weight if I stop Ozempic? Weight regain seems to be common with other incretin mimetics when treatment is stopped, as shown in studies with semaglutide, Ozempic, Wegovy. In studies with semaglutide, patients who stopped treatment still had an overall weight loss of 5.6% of their original weight after 52 weeks, but the placebo group was close to their original starting weight. Learn more, what happens when you stop taking Ozempic. Finally, remember, it's hard to lose weight. Obesity or overweight are medical conditions and not a failing of willpower. And regaining weight after initially losing it can take a toll on your mental health. Keep your mind strong by staying active, eating healthfully, maintaining your social circles, getting and talking to a trusted partner or healthcare provider when needed. This is not all the information you need to know about Tirzepatide, Zepbound, for safe and effective use and does not take the place of your doctor's directions. Review the full product information and discuss this information and any questions you have with your doctor or other healthcare provider, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.